All right, and welcome to another edition of Mondays with the Mayor. I'm Daryl Grinnell. It's good to be here this evening, and good evening to everyone out there. And send out a special hello to Miss Helen, who always listens to the show. It's really good to be here. As we know, we are in the midst of a pandemic, and there have been several stay-home orders that have been put in place. The first was put in place by the city of Natchez several weeks ago. And as we all know, on last week, the governor for the state of Mississippi has issued a stay-home order. What that means is you can go and take care of essential items, that is, necessities, such as food. You can go to your pharmacy to get medication. You can also go to a healthcare provider where appropriate. But other than that, you cannot go to non-essential places. Secondly, you can go out and exercise. You can jog, you can walk, you can go biking. But you have to be very careful when you're out there that you maintain social distancing. You should not group up with other individuals in this community. This virus is highly contagious. And this evening on the show, I have several members of the task force for the city of Natchez. We have the co-chairman, Mr. William Thames, and we also have a member of the task force, Ms. Chesney Doyle. So at this time, I'm going to turn it over to the co-chair of the task force for COVID-19, Mr. William Thames. William?
Thank you, Mayor. Our purpose for being here with you today is just to remind everyone of the seriousness of the threat that our community is facing. We've known of this for quite some time now, but from the beginning of the year, really. It was something that popped up on the news as occurring in China, and then suddenly it became at the forefront of our news here in the United States beginning really in February. And we began seeing that this was going to be a threat to our community. And you, Mr. Mayor, created the task force that brought this to the attention of our community as we started looking for ways to educate our friends and neighbors and fellow citizens here in Natchez and in Adams County as a whole to keep ourselves safe and healthy as best as we can. And we've been working diligently at that, many of us literally spending hours upon hours every day, 7 days a week, thinking about and creating methods by which we can keep our community safe and then implementing those measures to help keep our community safe. And in many ways, I feel we've done just about all we can in terms of trying to get the message out there. And now it's just a matter of helping people to understand that this is real. It is happening. We have many patients right now in our hospital here in Adams County in Natchez on ventilators, struggling for their lives with this disease. And many of those people, all of those people might not be there if the people around them and they themselves had exercised the proper precautions to protect our community from this virus getting it in its grips. So we are here really pleading with everyone to still help minimize any further pain and suffering and death and illness in our community by adhering to this order to stay at home. That's all that will save us, is stay at home. Only in the most urgent of circumstances should you be out in contact with other people. As the mayor said, going out to exercise by yourself or with perhaps another person at a distance. Um, we've got to maintain our sanity, and that's not easily done staying inside our houses or never leaving our homes. But we have to avoid social contact and even business contact, except in the most urgent of circumstances.
Hey, William, I think it's important for the citizens to understand that when they need to go to, for example, the grocery store, that they identify someone in their family as a designee that will go into that store and shop on behalf of the family in lieu of, you know, several individuals from the same family going into a store.
Yes, sir. That's very important. Because of the urgency of this situation, going to a grocery store or a drugstore cannot be a family social outing any longer. And I realize there are single parents who may have a hard time finding someone to watch their children while they go shopping. But if there is any way that you can, that needs to be done, because children are difficult to corral and keep under strict control. They want to go and reach and play with things, and that's understandable. That's what children do. But we are really wanting people to avoid bringing anyone with them. Only one person from a family into the store, if at all possible. But having said that, it's starting to get hot, and we sure don't want anyone leaving anyone, adult or child, in a hot car while they're shopping. So if you can, go by yourself, go alone to the grocery store, get your shopping done safely, wearing a mask. And the 2 times I've gone in the last 3 weeks, I've carried Clorox wipes with me to pick items up, to avoid touching things that could possibly have the virus on them, because it is a surface contaminant as well as an airborne contaminant. This is a highly, highly contagious virus. And yes, the vast majority of people experience the virus with no ill effect, but those who do say they have never been sicker in their lives, and many are literally dying. We had a death today. An Adams County resident died today at the hospital. So again, only one person, if at all possible, into the store, do your business and get out.
You know, William, I'm glad you brought it up, that this virus is highly contagious, and you really emphasize that. And it's important for my listening audience to know that this virus is highly contagious. Therefore, if you have to take your child in the store with you, you've got to keep them under control, because you don't want for them to pick up this virus from anything. Another thing that William mentioned.
Wearing masks. If I could interject at this point, while we're on that point, children need to be wearing masks as well. They may not be at all sick or showing any symptom, but they may have the virus. Many children have it without showing any evidence at all that they have it. So to protect people around them, we must have children wearing masks as well.
Right. And this is one thing that we're pushing from the task force of the city of Natchez, is that we are strongly encouraging citizens out there, when you go to the store, or if you have to go to the pharmacy, to wear some type of face covering, a mask or a scarf or a bandana, something that will cover your face when you go out into the public areas to shop and pick up your necessities. So we are strongly urging the citizens of our community to please do that. William, do you not agree?
I absolutely fully agree, yes. I have, at this moment, I'm walking around with a large bandana tied around my neck, ready to pull up over my face in the event that someone comes to my door, so that I'm not facing them without my face covered.
Okay. We also have a member of the task force, Mrs. Chesney Doyle. Chesney?
Well, thank you. I wanted to just jump in there on this point and talk about an observation I've made. There is still a misunderstanding or an idea out there that the hospital, that our medical professionals can somehow cure this. And that is totally wrong. There is no cure. So, every week we have conference calls, our task force does, and we listen to Lance Boyd, the CEO at Merritt Hospital, talk about what's happening there and the patients, and the fact that once you go on the vent, there's a 70% chance that you will not make it, that you will die. There is no cure. The only way to stop this thing is for people to stay home and to not contract the disease and to not spread the disease. So for every individual out there listening right now, everyone who makes the decision to stay home, that is one person who hopefully will not end up in the hospital. That is one person who will not spread the disease to another person. That's the weapon we have. That's the weapon God has given us to fight this disease. Stay home.
Okay, so on that note, the city of Natchez, along with United Mississippi Bank, Concordia Bank, also the city of Vidalia, have purchased yard signs that, gives a simple message that says, stay home, COVID-19 kills. And we've got a shipment of signs that are coming in this evening. So Chesney, do you want to talk about the disbursement? So if anyone out there who's interested in a yard sign being placed in their yard, Chesney, you want to talk about that method?
Yes, I'd be happy to. The message on the sign, it simply says, stay home, COVID-19 kills. And the reason for these yard signs is that we have a grassroots problem. And that means we have a problem that's not going to be solved by the governor or the mayor. It's going to be solved by individuals at the grassroots level making the decision to stay home. And so what we're counting on with these yard signs is that neighbors will influence neighbors. They will influence other family members. And from the beginning of this task force, when we started to spread the word about what was happening, we called upon people to not be sheep, be shepherds. If you understand and you've gotten the message, now is the time to be a shepherd and go out there and lead your friends and your neighbors into safe behavior. Lead them to make decisions that will save their very lives and the lives of others. We have a lot of religious leaders in this country, not just here in Natchez, but in practically every state in the country, who are misunderstanding the battle. This is not a time to be fighting the battle of church versus state. This is a time for us all to be coming together to use the brains and the common sense that God has given us and fight this terrible, contagious disease, coronavirus, COVID-19. So the yard signs are a way for individuals to put a stake in the ground in their very own front yards and communicate to their friends and their neighbors, we are staying home and we want you to as well. Again, be a shepherd, don't be a sheep. That said, yes, go ahead.
Yeah, I was going to ask you if a person out there, because I just received a text message where a person said, I want some signs. What is the method in which these signs will be dispersed, Chesney?
Okay, well, we have several different ways that's going to be happening. First of all, tomorrow probably around noon at the Natchez Convention Center, people can come and pick up a sign. Again, we'll have a few people there spread very far apart to help with that, and we don't expect any large crowds or congregating. That would be the opposite of what we're trying to accomplish. But I would say by 12 o'clock tomorrow, we will have some signs ready for distribution. And if you are out and about, want to swing by, can get you a sign. The city of Vidalia will be picking up several hundred signs, and these have been underwritten by Concordia Bank, and also United Mississippi Bank has underwritten signs, and they will be distributing those signs in the Vidalia and Concordia Parish neighborhoods. The city of Natchez will be distributing signs around in different neighborhoods. Also, you can call the city hall or you can call the county and give your name, your address, your phone number, and the number of signs that you would like, and we will have someone deliver the sign to you. And then finally, the Community Alliance has stepped forward, and they will be setting up a website or a Facebook event. I'm not quite sure how it will work, but there will be an opportunity there for people to basically order a sign to be delivered or picked up, and to contribute $5 per sign, because these signs are expensive. So we will be accepting contributions through the Community Alliance website. Now, was that clear, or was that kind of confusing and rambling?
Right. But let's also emphasize to the public that, that they do not have to pay for a sign. If an individual wants a sign, it will be available to them, but those that would like to make a donation to help to defray the cost, that's fine. But the signs are actually free, because our mission is to get the word out. Now, Chesney, as far as the convention center, that will be on the Canal Street side, where they just simply pull up. A sign will be handed to them. They don't even have to get out the car. They just let their window down and the sign goes in, correct?
Exactly.
Okay.
Canal Street side, where the glass lobby is. And we'll be distributing signs until we run out.
Right. So we want to get the word out. And as Chesney mentioned, it's a grassroots effort. It's going to take neighbors, working with neighbors to say, spreading the word. People have got to stay in. We cannot congregate. This disease, as William mentioned, is highly contagious. And the best way, when you're in the midst of a pandemic that's caused by a virus or a microscopic organism, the best way of treating it is you have to treat it as if everybody has it. That's just the way you have to look at it, and you have to program yourself. And more importantly, you've got to keep your hands away from your face and make sure you wash your hands. Are there any things that we need to mention as a task force to the audience out there, William? Any other items that we overlook?
Not that I can think of, above and beyond just not getting into any crowd for any reason. We can sacrifice a few weeks. If we do not, this will not go away. The longer we refuse to use good judgment and good common sense, the longer our community is going to suffer. Jobs will be non existent. The faster we use our common sense in our minds, the faster we'll all get back to work.
William, will you express to the public why it's important for us to avoid a spike in this disease? That is, why we should
Yes.
avoid a major number of individuals being infected in this community.
Yes, I will. Our hospital resources, not only in our community but in all communities, are finite. We only have so many hospital beds, only so many ICU beds, only so many ventilators, and only so many healthcare providers to take care of sick patients. And without any measures in place to slow the spread of this unusually highly infectious disease, everyone's going to become infected at once, and all of those very sick, critically ill patients, and again, it's only a certain percentage of the patients, but there are enough that our hospitals will be overwhelmed. And we are not a large community, and we do not have a particularly large hospital. So if a large number of patients hit the hospital all at once, all of our ventilators are going to be in use. And then very difficult decisions are going to have to be made as to when the next patient requiring a ventilator rolls in the door and there are two patients and only one ventilator left, someone's going to have to make a choice of which one of those patients gets that ventilator. That is a very awful choice to have to make for the person making the decision and for the person needing the ventilator and their families. We need to avoid that. Right now, we have more ventilators in use at our hospital than we had 4 weeks ago. Fortunately, we were able to, when I say we, our hospital was able to scrounge around and corral some additional ventilators, and every one of them plus are in use right now. So if we hit our hospital with too much of a patient load all at once, those patients are going to likely not make it. And no hospitals will, everyone else is burdened as well. You cannot transfer a patient from our hospital who needs a ventilator to another hospital. So this is a critical need.
Thank you, William. That's important for people to understand why we should avoid a spike in terms of this disease in our community. And we have to also understand that we've got neighboring communities that depend on our hospitals. And a lot of our neighboring communities in their hospitals, they don't even have ventilators. So, a lot of them have to be shipped here so that it could exhaust the number of ventilators that we have here in our community. Chesney, any other words that you wanted to mention?
Well, I think that the point that you and William were just making is critically important for people to understand. Our hospital is not just serving Adams County residents. So just because you live in Adams County or Natchez, don't think that there's going to be a place for you or your loved one at our hospital when you get the disease. Because we have all of these people coming from surrounding counties and from Concordia Parish. So down in Wilkinson County, they have the highest infection rate in the state of Mississippi. They have people who are known positive walking around, congregating. And, it's spreading like wildfire. So where do they go when they get sick? Well, they come here to Merritt Hospital. And so this disease is not going to be fixed or cured on the hospital side of the equation. It is only going to be stopped on the human, individual decision side of the equation, the community side. People have got to decide. You, as an individual, must decide whether you're going to be part of the cure, part of the solution, or are you going to be part of the problem and the ongoing increasing infection and mortality rate? It's a decision every single person in this city and county and state and this country has to make for themselves.
Thank you, Chesney. On tomorrow, I will be meeting by teleconference with the mayors of the greater Missoula area. We formed a coalition. I met with them on last week, so we're going to meet again this week on tomorrow. That's the mayor of Faraday, Vidalia, Woodville, Bude, Roxy, Meadville, Fayette, and Port Gibson. So we will have our second meeting on tomorrow where we are working collectively as mayors to try to reduce the spread of this disease in our various communities. So we will have that meeting on tomorrow, and we will keep the community updated on our progress and what we come up with from that meeting. But it was actually last week's meeting with the mayors of the greater Missoula area, the coalition, where I got the idea of the yard signs from the mayor of Port Gibson because they've implemented a yard sign type of program there in Port Gibson. So we decided to take that idea and use it for this area in Natchez and Vidalia. And we're going to be working with the other communities to try to implement that program in order to spread the word and to get this grassroots effort moving forward. So if there's nothing else from the co-chair, Mr. William Thames or Ms. Chesney Doyle, anything else before we end the show?
Just everyone be safe.
And thank you for having us, and thank you, Mayor Grinnell, for your leadership.
Thank you, William. Thank you, Chesney. And thanks to WMIS, W2IJ, and the entire listening audience. To echo what William just said, please be safe. Let's be proactive. Let's do the right thing. Let's stay home. Thank you. God bless each of you. God bless our communities.